Welcome to The Honest Nurse. Here at The Honest Nurse, it's really our mission to try to educate patients as well as inform other nurses as well. And you may or may not know this, but for the 20th year in a row, nurses have been recognized as being the most trusted, honest, and ethical profession. Here at The Honest Nurse, we are so proud of that recognition because nurses work so hard to get that recognition. We have a duty to protect our patients from harm, no matter what the source of that harm might be, and we take this responsibility very seriously. It's really important, though, that the public, our patients, know the conflict that nurses face every single day within the workplace to try to advocate for the patients. Do you know how hard it is to be honest? It is damn hard. And first, I promise you, my viewers, that none of these examples I'll describe are fabricated. In fact, you can't make this stuff up. Healthcare settings are a microcosm of society. People from all walks of life and circumstances access healthcare every day. As in most systems, order and structure are necessary to achieve a goal. And that could be winning a basketball game, completing a construction project, or if you were a manager of a grocery store, it doesn't matter. Providing responsible health care is no different. We require structure and we require order. Yet, with the most important goal of achieving good Facebook and Twitter posts, administration has given in to the demands of patients who want their own set of rules and regulations, regardless of what their individual demands do to the provision of health care for the rest of us. Now, back in the days of a more civilized healthcare society, we respected the needs of others as well as our own. No one person's needs were more important than any other. So I'm going to give you a real-life example of what I mean by this. And as I said, none of this is made up. This is an example of an incident that actually happened to me years ago as a house supervisor at a big inner-city hospital. The rules, like most people know, are that there's only certain areas of the hospital setting where people can smoke. And back in the day, that was outside. Obviously, they could go to their car. There was no place inside the hospital where they could smoke. One evening, I was doing my rounds as a supervisor, and I got a phone call from one of the nurses on the floors telling me that a patient's family had complained that there was a group of people smoking by the entrance to the hospital. So, in my due diligence, I went down and found a group of about, I'm going to say maybe 8, 9 people. Of those 9 people, I think one of them was a patient. So this patient had a lot of friends and family that was there, and they were all smoking outside by the entrance. At that time, I had to consider whose needs are really more important at this time, and how do I best meet the needs of everybody in the system, not just these particular people who wanted to smoke. So I asked them, is it possible for you to move to a different area, maybe your car, maybe out in the parking lot, something that was away from the entrance to the facility? And I also told them that I was getting complaints from other visitors that were coming in the hospital, that the smoke was following them into the hospital, etc. So you can see I'm trying to create the illusion and the picture of a place where a lot of people were complaining, and this is a simple problem to fix. The patients and family refused to move. At that point then, I just went on about my day. What can I do? I mean, I could call the police, I could make a big scene, but I decided not to do that. So I just let it go. Wasn't happy about that, but I had to let it go. Found out then, that following Monday morning, that the same family of smokers and their patient had gone to the administrators and complained that they were told they couldn't smoke outside the hospital. Rather than for the hospital administrators to back me up and say, yes, well, we have a rule, it's clearly posted that you're not supposed to smoke anywhere near the hospital grounds, they decided instead to give this particular family a bench where they could sit outside the hospital and smoke. Sounds like a little thing, probably, to a lot of people, but the point of it is, I put myself out. I'm trying to do what's best for all the patients involved, all the family members involved, not just for these one particular people that are smoking. And I was not supported. kind of takes the wind out of your sails when you're in an administrative type position like I was. So that's the example, right? So when the patient is faced with trying to go by the rules and regulations as informed by the nurse, immediately, and this happens not just in my own situation, but in countless times, patients and or their family members will complain to the supervisors, and who will cave every single time. Because administrators, physicians, CEOs, and the like want the patient's money, and they want your business. And anyone who gets in the way of that goal is expendable. Enter the honest nurse. So the honest nurse is expendable because she is only a service provider. That's it. The nurse does not recruit business for the hospital, yet it is the nurse who is assigned the most important tasks of patient care. And while they're on the front line of nursing care, they're often not recognized, not encouraged, and not empowered to exercise nursing judgments without the approval of a superior. Now, those of us in the nursing profession know that many patients will ask questions of us that they would never ask their own physician. Those questions give us a lot of keen insight into a patient's emotional concerns and their level of understanding about what's going on with their care. I'll give you an example of that again. Now here's an example of 5 questions that we often hear in the operating room, which is my area of expertise. Okay, number 1, is the blood supply safe? Number 2, will there be pain after my surgery? Number 3, I ate or drank after I was supposed to stop. Number 4, I don't think I'm going to wake up after my surgery. Number 5, I don't have anyone to stay with me after I get home today. Now, what's the nurse supposed to do with this kind of information? Well, I can tell you. On question number 1, is the blood supply safe? We don't really know. Will there be pain after my surgery? Yeah. We use sharp operating instruments in the operating room and they hurt, so yes, you will have pain. Now, you can't believe how many patients will tell you, I didn't think this was going to be painful. They really believe that and are shocked if they do have pain after surgery, right? Number 3, I ate or drank after I was supposed to stop. Now, there was reasons why we put those kind of rules and regulations in place. I'm not going to get into that here. It's a much bigger discussion. But the reasons that we put those rules in place are for the safety of the patient. If you don't follow the rule, if you don't follow the regulation, for whatever reason, we cannot provide you with the care we'd like for you to have. Number 4, I don't think I'm going to wake up after my surgery. Now, when I was in training as an anesthetist, I was told by my supervisors and my educators at the time that whenever a patient comes to you with that kind of a concern, that tells you what's in their head, that they think they're going to die. Okay. Number 5, I don't have anyone to stay with me after I get home today. Now, you were supposed to arrange to have somebody to stay home with you. If in fact that's really true and you have no one, you're putting yourself at risk when you get home. Okay. This is what the honest nurse is going to say to the patient, correct? In any one of those questions, were you to go to the administrator? Were you to go to the physician, perhaps the surgeon, or the CEO, anybody involved in the care of this patient, and say, I think we might want to pull back on this because this patient thinks they're going to die. What do you think the response is? I hope after hearing this kind of a discussion, you understand what the response is, and it is consistent. They're just crazy. They're probably just nervous. Give them some Versed. I don't know what's wrong with them. Let's just get on with it. That's the response that you get. And why is that? Well, let's go back to the earlier conference in this video. It's because they want your money and they want your business. And they don't want anybody to get in the way of that. So, my counsel to you as patients, as well as to nurses, do your own research. Ask questions. Consider all the time that there are other agendas at work in the healthcare setting that you may or may not even be aware of. Just educate yourself. And the way I look at this is much in the way that the country music singer Aaron Tippin did when he said, you better stand for something or you'll fall for anything. So stay tuned. Thanks for watching. There'll be more to come.